I feel very privileged to work with our oncology and haematology patients. I feel we get to meet them sometimes in the worst situation they can find themselves in. And I find it's very humbling, really.
Cheltenham Hospital's Wrencombe Cancer Ward does feel calm and well run when you walk in, and such is its reputation. They even have a waiting list for nurses wanting to work here.
So when you even step into the oncology building, it's positive. There's a good staff culture. We support each other of all levels of staff. I would say there's very much not a hierarchy.
It is quite clear, being on this oncology ward in Cheltenham Hospital, just how important it is that it is fully staffed by the nurses that they have planned for. But after a 10-month battle, the Channel 4 News fact-check team has been able to identify from the vast data set that's held by the NHS that this is not happening elsewhere. In March, we revealed NHS hospitals are consistently unable to staff acute wards with registered nurses to the desired level, even taking into account temporary and agency nurses. Now we have drilled down into those figures and we can reveal the extent of registered nurse shortages across oncology and haematology wards. These are the people who care for cancer patients as well as those with cancers of the blood and other blood disorders. Data from January 2023 to November 2024 reveals that on a monthly average, 1/3 of acute hospitals in England were missing at least 10% of their planned nurses on these wards. When you ask Franco Kovalchek what helps him through his blood cancer treatment, he says it's the specialist nurses.
It's having somebody that you could turn to that may not necessarily be for like major problems, but you've got things that you need to ask and you want information or you want clarity or reassurance, and there needs to be somebody there that can provide that.
But that was at this hospital. There are 3 cancer nurse specialists here, available, he says, to help him navigate his care. Ask Franco about his rather brutal treatment for his myeloma at another hospital, and what stood out for him was the lack of nurse specialists.
The times I tried to contact her, she was never available. The telephone number was unobtainable and the email address was never answered.
This is much needed downtime for Hilary Maxwell, a cancer nurse specialist who is now managing as many as 600 patients, 6 times more than is ideal.
And I don't believe that's very different to many of my colleagues.
But that's unsustainable.
It's not sustainable, it's unmanageable. They want to do the very best for their cancer patients, but it isn't sustainable.
Give me an example of what happens when there is not a cancer nurse specialist, a specialist nurse to call up or to speak to.
Well, the patient will be left abandoned. They will have no resource for help, guidance. They won't understand their pathway. They will not have somebody to request their imaging, any diagnostic tests. They will not be able to push their cases through MDT, the multidisciplinary team, in a timely way. And they will lack a significant amount of emotional support. And at the end of the day, most of my cancer patients want to pick up that phone and they want to speak with their clinical nurse specialist.
The NHS told us that safe staffing was a priority, and while the number of nurses working has reached its highest level, they added, "We know there is more to do." They said it is essential that NHS trusts take all possible steps to ensure suitable nursing expertise is in place to deliver timely, high quality and personalised care for those living with cancer or a blood disorder. But whether they are specialist nurses or have, like on this ward, simply chosen to work in oncology, the patients here will tell you their experience is made just that much easier by their very presence.
And you can find out how many nurses are missing from wards in your local hospital by going to channel4.com/nursecheck.